I'm originally from the Ghent, Minnesota area. I got into chiropractic care from a number of different sports injuries that took place in my life. And I've gone a number of different routes and found that chiropractic was just something that resonated a little bit deeper with me. I'm married. I've got 5 kids. Oldest is 8. The youngest here is just under 2 months.
I was like, that's new since I talked to you last.
Yep. So 2 boys and then 3 girls that have followed. And I guess with the practice that I have, we like trying to continue to improve and try different things. So we've got decompression tables, which help significantly with disc injuries. So numbness, tingling. A lot of athletes have had injuries just from, again, falling from high up or getting tackled, whatever it may be in the sport, wrestling. And it makes a big difference to help with those disc injuries. We also use laser therapy. So we've got a class 4 hot heat laser, which makes a massive difference. I like to say it's taking your cells from being in a frozen state to a more activated state. I guess that's kind of in a nutshell, just different pieces that we get to go through there.
Okay, thanks. Okay, Chris, go for it.
So I'm Chris Wagner. I am a physician assistant at Access Health here in town. I've been practicing 24 years now. I'm originally from South Dakota and went to school out in Illinois at Rosalind Franklin Medical School, and then came here as my first job, and I never left. I'm married. I have 2 kids. I'm going to be a grandma in a month, which is crazy to me. And then my youngest is at Bethany Lutheran College, also studying exercise science, playing basketball there. I work in family medicine, so I do birth to death, and we diagnose, treat, prescribe, a little bit of everything.
Nice, awesome. Okay, so I have a few questions that I will ask, and then they all prepared last week. They've got some really good questions for you. So when I went through the questions, I highlighted the ones to try to get a variety from all of you on your cards. So
Interject, Chris, one thing.
Yeah.
So I am not obviously a female, but I'll try and answer questions from a female's perspective for Dr. Alley, since she's not here tonight. I graduated from SMSU actually with her. And I'm very fortunate to have been a part of a mastermind group with a lot of other chiropractors that are female. Actually, the group that I'm with is about 50-50. So I get to hear about just different things that they're going through as moms, as parents in practice. So if there are questions that you guys have that's coming from that field, please don't. I mean, I'll do my best. I guess put it that way.
thanks, I appreciate that. Yeah. Okay. Talk a little bit about where you went to school and how you chose the school you went to.
Okay, so for myself, like I said, originally from Ghent, Minnesota area here, SMSU was too close for me. So I actually went to SDSU for about 3 years. And then I decided that SMSU was actually just right. So then I came back here for essentially my last year, graduated, and then I went to Northwestern Health Sciences University, which is actually up in the cities. I chose that one because, again, I knew some family in the area, so it made a big difference to have local connections. The school is 3 1/3 years long, so 10 trimesters that you get to plug on through. And some of the other ones that I really looked at were down in Palmer, which is in Iowa, but to Iowa. And I can say that because my wife is from there. So yeah, I guess that's kind of the schooling in a nutshell.
Okay, thanks, Chris.
So I started at the U of M in Morris, and I went there for 2 years and then transferred to the University of Minnesota. I graduated with a degree at the time. It was called kinesiology, very similar to exercise science, but at that school, it was the first year. So we did a lot of like your science work, but also some phy-ed work, kind of teaching type avenue. So they kind of combined in that. And then I applied to like 10 schools for PA school. I had interviews at 3, and I got in at what at the time it was called Finch University of Health Sciences, Chicago Medical School. It's now called Rosalind Franklin Medical School. Obviously I went where I got in, so, and that was in Illinois, North Chicago, Illinois. So we went there for 2 years. It's, you start in May, you do an ethics class, and then cadaver lab anatomy right away in the summer. And then you kind of delve into the internal medicine and psych and everything else. So we do a full year of didactic, and then a full year of clinical rotations. Those can take you all across the country. Most of mine were in Illinois and Minnesota. I had one in Wisconsin for surgery. Basically, you kind of pick locations where you think you might want to go. So people would go where they had family, or in my case, I was already married. So I wanted to be within driving distance of where I was living at the time. You do rotation in family medicine, OB, peds, psych, general surgery, and ER. And each of them are about, I suppose, 8 weeks long. And then when you're done with the didactic, you sit for an exam. And then you keep your CMEs up every 2 years, 100 CMEs. So, yeah. So, and then, like I said, I ended up here and just started practicing family medicine. I thought I wanted to go into orthopedics. I was hell-bent on that until I did family medicine rotation. And I was like, I love this. I love that I get to see babies. I love that I get to see old people and I see their families. And interestingly enough, being in a small town, I have a lot of people that I don't know they're related. And then all of a sudden they'll say, well, you see my brother or my sister or my mother. And I'm like, oh yeah, now the resemblance. So, yeah, so that's where I went. Thanks.
Areas of specialty, if you have one, and if you don't, you kind of already went into that, but what's your favorite thing, or what are you really studying? You know, Dr. Rob, you said you're in, you know, always looking at new things, but what's your specialty, if you have one, or what are you really interested in right now?
So I take care of joints, I guess is how I would look at it. So I mean, I take care of birth to death as well. With all of my children, I've adjusted them pretty much as soon as possible, so within 30 minutes to an hour, as well as some patients, you know, into their hundreds. All depends on kind of what's going on with their bodies. I love being able to work with other practitioners as well. So I work with athletes who are here in college now. I try to work with their trainers as best as I can when it comes to that, refer out to the Orthopedic Institute if they need surgeries or if they've got particular injuries that have taken place. I enjoy most having been an athlete working with athletes, but what I find I get some of my most joy out of is somebody who's never experienced care before, or doesn't actually know what we can provide and take care of for them. So that's actually a lot of individuals who've not been athletes, who've had multiple injuries, car accidents, posture related things that just build up over time from repetitive stress injuries, and helping them get back to doing things that they absolutely love doing. So for a lot of people, that's sleep, or being able to sit at work, or get up and down from the ground with their kids because they can't necessarily do that anymore. That's what I really enjoy getting to do. So I like to say taking care of the chicken and the egg. So both the joint, making sure that that's moving, but also taking care of the muscle that leads to that joint not functioning, or vice versa, because I know that they just continue to feed into each other.
Good. So as I said, I do family medicine, but as a PA, you can work in general surgery, cardiovascular, neurology, psych, peds, pretty much anything. And the nice thing about my practice, or being a PA, is if tomorrow I decided I wanted to go work in orthopedics, I could leave my job, go start a job and work in orthopedics. You're taught all of it. And so you have that flexibility to weave in and out of different specialties depending on where life takes you. But I chose family medicine simply because I love everything. I love the family unit. I love littles. I love old people. And it's the same thing. I love seeing them go from maybe they're struggling and then you help them through and now they're on the other side and doing well. So that brings a lot of joy. And I think anybody who went into any type of medicine, that's always your goal. And why you go into medicine is to help others. So.
And I should say with chiropractic, there's a lot of different specialties that you can look at as well. I know practitioners, of course, not around this kind of an area. It just tends to work a lot better if you've got the whole family unit, but that are strictly neurological based up in the cities that strictly see only children, or only see more geriatric, or ones who work only with athletes that are working in colleges. A good colleague of mine actually travels around with the Saints as well as LSU for both those teams. He competes and helps work with them. So I mean, there's a lot of time that he's traveling and spending away from his family. There are also some who will work specifically with feet or extremities. So it just depends on kind of where you want to practice and then how you want to continue to evolve that as well.
Excellent. All right. Whoever wants to take this one first. A day in the life. Either Dr. Rob or Chris, you guys duke it out. Who wants to go first?
For me, being a business owner, I'm gonna break it down kind of from like 100% ratio. So I would say that 50% of the time I'm practicing by adjusting, taking care of spines or whatever it might be. Probably about 30% of the time, I should say actually between 30 and 40% of the time, I'm doing paperwork, keeping up with different pieces. And the last about 15 to 20% is either going to be in marketing, doing different events like this, which I'm fortunate to be able to do, and making more of the business decisions or back business options, like working with insurance is helping train my team, helping coordinate a lot of different things that come in that factor.
And I start clinic at 8 in the morning and I see my last patient around 4 to 4:30. I will see anywhere from 17 to 20 people per day, and I will do everything from just a med recheck to a physical, sports physicals, clean ears. Somebody can't hear, and you're just gonna tell the nurse to clean their ears. You got to look in the ears first, things like that. And I do a ton of paperwork as well. I will go home tonight and probably work 2 or 3 hours doing paperwork.
You're still doing that?
Yeah, unfortunately. Some of it is my own fault. I'm very OCD. I want to make sure the chart is accurate. And so I do a lot of past review of things. And if they're brand new to me, I'm populating that chart from scratch. Not everybody does that, but I think that's important. And then it just helps, like the next time they come in, everything's updated and I don't have to worry about adding things in. So paperwork though is a pain in the butt. There's a lot of messages that come in, a lot of med bills, and then the insurance world is kind of a nightmare sometimes. Yeah. So, but I would say, I probably spend 50% of my time doing paperwork as well. I try to do it during the day. Usually it stays pretty good, but once that first person is late, then it kind of has a ripple effect throughout the day where you don't have time to get it done. So, yeah.
You guys will hear that quite a bit about the paperwork thing, how much everyone loves to do the paperwork. Right.
You just have to mentally take it into an aspect of the fact that means I get to help these people.
Yep.
So you have to mentally spin it because it's the same thing that you guys are doing right now. I'm sorry, school sucks. I'm so grateful I'm not here anymore. But it was a stepping stone to where I knew I wanted to be. So
Yeah.
it's well worth it. And I mean,
It means to an end, right?
correct. It's a means to take care of the things like I need to ethically be doing. And it allows me to then continue to do what I want to do, which is take care of people.
Whatever you do, if you ever go into any kind of medicine, do not skip on your paperwork. Do not say you did something if you didn't do it. And do not, like I have seen patients where they were like, they didn't even put a hand on me. And I'm like, oh, okay. And the whole documentation is that they did a head to toe exam. And they were like, no, they didn't even come near me. They barely stepped in the room. So that's a big no-no. Don't do that. So.
Only once I had to testify in court, and it was probably 3 to 4 years after I treated the patient. Yeah, and it was like a left C4, and the lawyer, when you see the lawyers that are like, did you do that? That's exactly how she was. Did you do this to this patient's left C4 on December 20, whatever? Wait a minute, let me look at my paperwork. Yeah, so it is. It is. Yeah. All right. Good. That's a good start. These guys have a lot of great questions, so I'm gonna let them take over. What's the best way if we just start here and work our way around, I think?
One kind of.
Oh, you have one kind of related.
That
Okay,
just came up.
so go ahead.
Okay, just from like a mom and a dad, like a parent role, do you think that your careers allow like flexibility with being able to do that and also being able to parent?
I will. That is exactly why I chose to be a PA. I originally was going to go into medicine, and I also wanted to get done though and have babies and be a parent. And so interestingly enough, in my little town where I come from of 800 people, I said, I want to be like Dr. Bartholomew. And my mom was like, he's not a doctor, he's a PA. And I'm like, what?
Didn't even know that.
I didn't know what it was at the time, right? And I was like, oh. So that's exactly why I went into medicine, into PA as a role, because I wanted to get in, I wanted to get done, and I wanted to start to practice. And yes, I would say my career has been very flexible that way. Here in Marshall, I have my own practice, so I can kind of decide how many people I want to see a day. As other clinics and other places you go, the bigger like metro cities, you're going to be maybe not running your own practice, and other people have a little bit of say on that, but there is some flexibility. So for me, it worked out great. And that's exactly why I went the route I went.
So for my side of things, I would also say that's one of the reasons why I love what I do. So my kids were in the office with me today, my two youngest, so the two girls. And that's a pretty regular occurrence. So I mean, like they will be, and thankfully my patients are relatively comfortable with it. I usually ask them as on both sides, obviously. But my kids will oftentimes just run directly into the room as I'm treating somebody, and they'll come up and they'll lay their hands on the patient and stuff like that too. So we're very family oriented and very, very fortunate to be able to do that part of things. I do know that it's more difficult for me because I'm a solo practitioner in my office, that if I've got a full day of patients, whatever that might be, it's more difficult for me to necessarily take off. So that's where I will actually bring my kids into the office with me. If I had multiple doctors that were working together, then you're usually able to say, hey, can you help cover for me? My kid's sick at home, I'm gonna go there. So it always depends upon what you're able to build up. But I've been one, again, being very fortunate with the fact that it's family oriented, same as this, that they come with me everywhere, essentially. So when I was first starting my practice, which took a lot of hours, they were out at different events or meeting people at parks, at fairgrounds, whatever it might have been. They're great attention getters.
I bet they are. I bet they are.
They're fun.
Before we start, I know this, so like one question to the next, but could you both explain, so if you could explain, because Landon's gonna talk to the other group here next week or whatever, but I think it's Thursday, yeah, so how you have your rehab specialists that help you, and then Chris, how it works that you have your own practice, but you technically are under an MD or a DO. Yeah, just explain that a little bit.
So with me, like I said, I've got a team that I'm blessed to be able to work with. And I guess we just know that we're very cohesive. Whichever one person's doing, everybody's always going to help to supplement it, be it my front desk, be it my billing, be it my rehab specialist, who's Landon. So Landon got his exercise science degree here. I actually got biology for myself for chiropractic, just as a back step. You can get essentially anything you want for a degree and go to be a chiropractor. You just have to have a certain number of basic sciences first to be able to get into school. But if I was doing it again, I would go back more exercise science or business if I was repeating, I guess, put it that way. But for the land and exercise science, he's working, we're always communicating on a regular basis with patients multiple times throughout the day as well, saying, hey, I've got somebody coming in, they've got a knee, ACL, or we think there's maybe an MCL tear or something like that, or they've got a disc injury. Here's what I'm thinking will be really good for movements or therapies to do. What would you maybe add into it or supplement along with that? So like I said, we're meeting constantly throughout the entire treatment plan or the care plan for each one of those patients that we're fortunate to work with.
So, yeah, and as an aside, Landon is speaking to the other class Thursday at 1:30. I know you guys are busy, but if you want to hear what he does.
Yeah.
And I would say mine's very similar. As a PA, you work with MD or DO, kind of collaboratively, I guess I would say. So they will oversee like my chart notes and such. They have to look at so many to make sure that we're doing what we're supposed to be doing. But like at the clinic here, we all kind of have our own practice, but I could literally be like, I'm just like, not sure on this one. I walk into one of the docs' rooms and I'm like, hey, here's what I got going on. What else would you be thinking? And they'll say, hey, have you checked this or this? Or, oh yeah, okay. And so I do that like all day long sometimes too, depending on the patient and what's going on. But we do always work collaboratively with the physician. So again, out in rural Minnesota, it's a little different than what you're going to get in the city. And then that autonomy looks different out here. They give us a lot of free rein, I suppose I would say. up in the cities. I know, like, if I was to do orthopedics, I know when I did my orthopedic rotation, I did at Mayo Clinic, the PA did mostly measuring of the hips, measuring the x-rays. They didn't always work directly with the patient very much. And that's why I kind of decided orthopedics wasn't what I wanted. I wanted to be more direct one-on-one with the patient. I didn't want to, we always call it a scut monkey. I don't know if you guys use that term, but we did. I didn't want to be someone's scut monkey. I wanted to have some freedom to do what I wanted to do. So that doesn't mean that I'm going to be a cowboy and, you know, go off on my own kind of thing. There's parameters, but we always work closely. And we have a lot of nurse practitioners. Nurse practitioners and PAs here in Marshall practice very similarly. PAs are taught the medical model, nurse practitioners are taught a nursing model. You have to have a nursing degree to go on to nurse practitioner school. As PAs, you just have to have a bachelor's degree to go on and get your PA certification. But we practice very similarly here. Technically, a nurse practitioner could like hang their own shingle and have their own business. Okay, a PA would never do that. They can't. They are supposed to collaboratively work with physicians, so that makes sense.
Yes, thank you, thank you. Okay. I know we have a lot of questions. I think I changed my mind. We're gonna do one question per table, go around until we run out of time. How's that sound? Okay, go.
Okay.
Okay, so
Yeah.
when you guys were talking about paperwork, and just kind of like, what does that paperwork look like? Or like, how much time do you spend on like paperwork like, per?
So I think that kind of depends. So like if I'm doing a physical, okay, I would say women over 50, okay, they have come with a laundry list of concerns. They usually have a past medical history, surgical history, a lot of stuff, okay? So my paperwork, it's an electronic medical record, but I'm basically taking their information that they're telling me and I'm putting it into the chart, okay? And then I might be visiting with them about their concerns and now I'm ordering some labs or some imaging or I'm referring them on somewhere. So it's basically doing a chart note. Do you guys, have they taught SOAP notes?
No, we don't go there. Mm-mm.
So a SOAP note is basically, what do you come in with? That's a subjective. The objective is your exam and then the assessment. What do you have in the plan? So we're basically doing that in electronic format. If you're just coming in because you have a cold or a congestion and I'm evaluating that, that's going to take me 5 minutes, okay? To see you, probably another 5 minutes to do the chart note. We have what's called, well, they're like a dot phrase. So basically I can hit, you know, dot URI and it populates my note. And then I just tweak the things like if you don't have tonsils, I take that out kind of thing. So I tweak it
A
to
Word
you.
document template.
Yeah, like a template, exactly. Yeah. So it all depends on the complication level of the patient, their past history and how much you're putting into the chart in my situation. So I would say like a physical for me, an older person might take 30 to 45 minutes per chart note, depending on how much I have to populate.
With the patient?
No, I do it without the patient. I'll ask the
Good,
patient
yeah,
some
yeah,
stuff.
yeah.
So as they're talking, I might, you know, where do you work? I pop that in there, you know, are you married? I click the button that says married. But then the whole, like my exam, the plan, assessment, I do that when I'm not in the room. So I have lots of little paper where I take quick little notes just to jot down and then that jogs my memory of, oh yeah, this person, I was gonna do this or that. So mine is variable.
That's why medical professionals, you can't read shit that they're saying.
Yeah.
Because they have to go so fast.
Yeah.
It's the same thing.
Good thing we have dictation.
For my notes, as much of the S that she was talking about subjective, I try to have them fill that all out and then I will go over it with them. So it's all done on computer stuff with one of my team members helping me out my front desk typically. So those notes things are significantly faster for me. Those will take about 20 to 30 minutes at the most, depending on complexity. So if it's neck and low back and knee or whatever it might be, or if it's just knee, that's a lot quicker of a process. And then because I have regular typically follow-ups with individuals multiple times a month or every week, whatever it might be, those notes will typically take me 5 minutes or less. Because there's little tweaks, and then I always talk with Landon to see what, again, he had gone through and what he found from his part of the examination. And our notes actually populate together. We've got that thankfully with the software in the system. So that significantly speeds up the process.
Okay. Table 2.
For you,
Did you always know you wanted to be a PA, or did you think about like NP, or was there like a deciding factor?
So I never wanted to be a nurse, so I never thought about nurse practitioner. I wanted to be, so originally I went to school as pre-PT, okay? And then I worked as a PTA, like a little aide, and I would go get the patients and then bring them to the physical therapist. And I was sitting there one day and I was like, nope, I don't want to be the one taking orders. I want to be giving orders. I'm a bit of a control freak. Yeah, so then I was like, okay, well then I'm going to do medicine. And then I was like, nope, I don't want to go for 10 more years. And that's how I got to the PA route. So, yep. But a nurse practitioner route is a great option. And, you know, like I said, here in Marshall, we practice very similarly. And we have a great relationship, you know, we would never be like, oh, they're a nurse practitioner. No. My nurse practitioner colleagues are awesome and wonderful and practice great medicine. And so, and sometimes they have a little advantage, I would say, because you go through, as a nurse, you work in a hospital setting, right? So you're used to starting IVs and ordering IV drips and things like that. I didn't do that. So when it came to, for instance, we worked urgent care a lot, they knew exactly how to, you know, quick draw and do that. I never had to do that. So that was an advantage that I would say that they had. So, yeah.
These for anything that you're looking at doing, I would definitely shadow.
Mhm.
And we can never say that enough. I worked as a CA, so a chiropractic assistant while I was going through school. And that was how I also realized I don't want to be the one who's continuing to do this piece. I loved it, very much appreciated it, but I wanted to make more money. That's really what it came down to. It's like, I'm doing this
Well,
for work.
you're
I
gonna work hard,
I
you
want to
know?
appreciate more
Yeah.
that way.
Yeah,
Um,
absolutely.
And it was just a big stepping stone for me to learn and actually see that.
How would you describe what you do to like somebody who doesn't understand anything about the field or like anything about medical field at all?
So I would say, basically you're gonna come in with a concern and I'm gonna help you figure out what the problem is and how to fix it. And we, as a PA, we are very much about educating you. So for instance, you might come in thinking you need an antibiotic for your cold because you think you have a sinus infection and I might not give you one, okay? But I'm gonna educate you why I'm not giving you one, okay? This is the reason, I want you to do X, Y, Z first. If it's progressing and not getting better, then we can still look at that option of antibiotic, for instance, okay? So we're taught very much how to educate the patient so that you can take good care of yourself. And I'm a huge advocate. If you don't understand what I'm telling you, you need to ask, okay? Because sometimes it's very, you know, second nature to us to explain something, but you might not understand what that is, okay? So if you don't understand, you can't help yourself, right? So it's really important that whatever your diagnosis is, that you understand what your diagnosis is and the best way to treat it from our side or from your own at home, for instance, okay? So that's how I would explain it.
You say the question again, just so I'm really processing it right.
How would you describe what you do to somebody who doesn't understand anything?
Thank you. So, as a chiropractor, chiropractor means hands or treating with hands. As a doctor, again, the root meaning of that word means teacher. So same thing, again, I think education is so important. So somebody may be coming into the office with, again, I'll say neck pain because that's what a lot of people say chiropractor for is for neck and low back. So when that individual comes in to see our office for the first time, I'm truly trying to say, okay, well, what's the source of this? And that's gonna be the whole purpose of our conversation today is to go through an examination, do orthopedic tests, do neurological tests, do functional tests, take x-rays if we need to take x-rays to make sure that you're in the right place because we need to start to figure out where is this coming from and then say, hey, can we help you? Because if we can help you, awesome, you're in the right place. But if not, where is it you need to go to get taken care of? But to really kind of dive back down into it, I call myself a chiropractor because I'm going to take care of you with my hands by making sure that what's going on is the right thing. So I've had patients who've come in. One really interesting one, I can't go into too many details because she's actually the only case in the last, I think, 100 years. 100 years. There's been less than 100 cases of this in Europe. And this is the first one that's ever been found in Minnesota, as far as I know. So it was a contact from some swine disease that way. And she came into the office in excruciating writhing pain, and I've usually been able to take care of things with shoulder and neck. And it's like, this is very, very different because the pain only continued to escalate. So what it was showing signs and symptoms of was like a disc or a herniated disc or a nerve rupture essentially. And it just wasn't presenting like the typical signs that I see. It's like, either I will bring you to the ER right now. And she's like, no, I'm going to call my son. So we essentially waited for that. And what had happened is she had a massive pocket of over 8 ounces worth of fluid, an infection that was going on. Like I said, this is the only case that's, to my knowledge, happened in Minnesota in the States. She went up to a number of different places to have that stuff biopsied. So, like I said, those are the different pieces. People come in saying, help, please, what's going on? And I say, okay, well, you're in the wrong place right now. We need to get you to the ER to figure that one out. Or appendixes, you come in and get a burst, or diverticulitis. A lot of times we'll see that because there's spasms that's going on with their guts, what's happening, and knowing that they need to go somewhere else and get that figured out or helped out with.
Good question.
Okay, you kind of already touched on this, but the question was, do different healthcare providers have different opinions and like philosophies on like what treatments they use? Like, for example, like prescribing medications versus not, or different chiropractic treatments?
I would say yes, 100%. Yeah, so as a PA, we're taught a medical model like a doctor, okay? Nurse practitioners are taught more the nursing model. And those in and of itself can change how you approach something for someone, okay? And then you have chiropractic care, you have naturopaths who don't do a lot of prescriptive medications, right? In my opinion, I think they all play a role. And they all could cohesively work together in order for the benefit of the patient. It's just a matter of sometimes the patient is not willing to do the treatment you recommend. Sometimes people are prescribed medicines they shouldn't have because whoever the provider is in whatever specialty, they're not listening to what the complaint is very well. They just want to write a script and get out of there, okay? That's part of the reason there's a lot of overuse of antibiotic, for instance. I've had people pissed because I won't give them an antibiotic, but I don't think they need one. And so it's more important, again, comes down to the education piece. But yes, I would say in medicine, everyone has different philosophies on how to approach things. And for a lot of years, I would say there has been some, not divide, but not necessarily cohesive work.
Divide
Yeah.
is accurate.
Chiropractic
Divide is
and
accurate.
I would say proper medicine, right? So I'm more open to some of that. Not every provider is. So, yeah. But I will say, like, sometimes, not necessarily you, but wording, for instance, my ankle is out. Okay, well, your ankle isn't out or you couldn't walk. Okay, so I hate the phrases that sometimes people are told. And I had a patient who had back pain and they said it was just back pain and he was having a heart attack. So that's where sometimes it depends on listening and paying attention. Like he said, he knew immediately this person needed to be in the ER, not keep treating her back and neck pain, okay? So I think it really is provider dependent as much as different entity dependent. I don't know.
It's completely provider dependent because you can see, obviously her and her colleagues, everyone is going to look at something a little bit different many times because of information, education, and obviously if they're doing a proper history, it should be going along the same pathway. But that doesn't mean that everybody follows that full path. You know, they might split on a different fork or something else because of experiences or history that they have. That's why a lot of practitioners, like I said, and I said divide because it's appropriate. Thankfully, most of that has become significantly more cohesive in probably the last 10 to 20 years. But before that, is quacked, and I can't disagree with it. If you go to chiropractic school, you'll get to meet a lot of different interesting characters because they're going to, because of different experiences. And I think that's in every practice.
Yeah.
Some people have bedside manners and some don't, okay? Where you then get to see how minds kind of work and how you're looking at things. But there's one particular type of chiropractic that's called Reiki. Google it. Very interesting. But Reiki, R-A-K-E, I believe. So if I remember right. But anyways, it's essentially where the person or the patient will be laying down on the table and the chiropractor is going to be treating their energy. So you don't even touch the person. So that's why, in my opinion, it's not chiropractic. You're not using your hands, but you will see the patient literally writhing up and down on the table. It's very interesting. And that's where I say everyone's gonna have a different philosophy and view based on education information that's at hand.
Interesting. All right. How about you guys?
This probably applies more for chiropractic. Are you ever afraid that you might hurt the client?
I think that's appropriate for both sides. but we're gonna look at it.
I would agree.
Anybody who works in healthcare?
Yeah,
Yes.
physically, yes. That's one thing I'm very firm in believing. And that's why, again, unfortunately, chiropractors have gotten a lot of negative feedback in many decades or since their start. Is because people come in there and I'm gonna blame this on your guys' generation because my brothers are in this one, is I want you to crack me like a glow stick, is something that my brother told me one time when he wanted to get tuned up, okay? Because they heard that phrase one time on TikTok and that's just how it worked.
What do they say on TikTok?
Yeah, thanks TikTok, exactly right. So again, that's where I say that's what some practitioners are gonna truly, that's how they're gonna practice. They're gonna go in there, they wanna hear as many crunches as possible because that's what they think the person's wanting. That is not necessarily what's always appropriate. So, that's kind of going back to, again, the philosophies of the practice, what you're going to be getting taken care of. But yes, absolutely, you're terrified. When you first start practicing, so you first learn adjusting in about the third trimester while you're at school and you practice on each other. So you could imagine the number of times that everybody's terrified as you're adjusting your own students, your classmates, your friends. If Allie was here, we were in classes together. That's why I was like that.
Sure,
See it that
sure.
way. But, it's interesting. How you're gonna do it.
And from my perspective, it's a patient, for instance, okay? You don't know how someone's gonna respond to a medication, and the last thing you want is for them to have a negative response to that. So, yeah, and especially like, I would say right now, the scariest part probably is the mental health piece. There's a lot of psychiatric concerns out there. And when we start medications, there's not enough psychiatrists in the area. So a lot of times they're coming into us and you recognize, Dan, they need some help. And I just don't want them to get worse, right? So we're giving them crisis hotline numbers, telling them to go to the ER. And if they're at risk, if they say, yes, I've had suicidal thoughts, then we do some more screening and then more screening. And sometimes I've had one, I sent her to the ER by ambulance because she wasn't going to have a ride otherwise. And I wanted to make sure she went there. So I would say, yeah, in medicine, it's scary. I did have one time someone came in and I gave them a shot of something and all of a sudden they started having breathing trouble. And I was like, holy crap, you know, and it scares you. And we called the ambulance and we had to reverse the medicine and they had never had it before. Didn't know they were going to respond that way. But the last thing you want to ever do is hurt anybody. So it is scary. And you get used to like medications, like in my field, when you first start, you don't know what you're doing, right? You're like looking everything up and I look it up right in front of the patient if I have to, but then you learn your medicines that you're used to doing and you do them over and over and over again. So you know the doses, you know if they're going to have major drug interactions and side effects and things. And so, you know, if somebody says, like I had one today, she messaged me, can you give me this? And I looked it up and I'm like, nope, I don't do that one. That is for psychiatry only. You got to go see them. I've never prescribed it. I'm not going to prescribe it. And you just set your boundaries sometimes there. So.
I had a patient, and still do, but she has POTS. So what that is, you'll have really random onset fainting spells. So when she was first coming in, again, this is something that we were very aware of. That's why she was coming in to get treated. To improve blood flow coming up into her brain, trying to take pressure off of her scalenes, everything, thoracic outlet syndrome she was having a lot of problems with. And a number of the first times as I was adjusting her, she would faint and pass out while I was adjusting her. So I mean, there's plenty of, it's the very first time that she did it, yeah, you both shit yourself. But again, we talked it through, we already knew everything. She understood the risks and everything else. And so we patiently waited, and it was a couple minutes later, she came to and was very grateful we went through all that process. So now it happens very rarely, but it'll still happen.
Who's going at this table?
So do you like using machines when you adjust people or more or less your hands?
Depends upon what the patient needs. Well, whatever it is that they need, be it the activator, which is the tool or the machine that you'll oftentimes say. Obviously, we've got a plethora of different, electrical stimulation or, ultrasound, laser decompression. I do Graston cupping, rock tape, so, options when it comes to that. I will use my hands. I'll use the table that drops up and down, so it's called drop piece. I'm trained in all of those different techniques when you're looking at chiropractic wise. And then you just tend to find, hey, this is one that I'm most comfortable with or what makes the most sense to me, and that's how you continue to practice. I'm actually looking at going and doing some continuing education because we have to do 22 credits every year as well. But there's a new technique, I'm pulling the blank on what it's called here right now, but they actually use balloons. They push them up into your sinuses and then you expand it so you can adjust all of the maxillary bones up and through their faces. So again, you can Google that too. It's very interesting. It helps a lot with patients who've got some significant long-term chronic headaches or migraines that's come from car accidents because they've had airbags blow up in their face, which then starts to cause a lot of different challenges.
I have an easy question for you guys. Has the internet made your job better or worse?
Well, Dr. Google, that, I would say TikTok is my
TikTok.
biggest pain in the butt right now
Yeah.
with this generation. They all think TikTok is like anything on there goes, including my own children.
Sometimes it's
Right.
Sometimes, but sometimes.
You
I'm
got a
like,
fact check though, right? We talk
Oh,
about
I
fact
fact check.
checking.
I fact check, but WebMD is also dangerous.
Yeah, there are times, the internet can be helpful, it can be harmful. People will put in, 2, 3 things and, oh my God, I got cancer. Okay, no, you do not have cancer. There's a lot more horses in the field. than
I'm
you.
that person.
Look for the horses, So yes, it can be helpful. I think education again, knowing what you're dealing with. If you want to do some research, I've had people bring stuff in and be like, okay, I did this. Okay, let's talk about this. Okay. Sometimes, yeah, okay, you're right on track. That looks great. Or, okay, this is why I would not recommend what they're saying. So I think it can be.
I would definitely say it just makes it more interesting.
There you go.
Like I say, I don't think there's a better way of putting it because sometimes it's absolutely right, like you're saying, and sometimes they're way out in left field. And that's where
Get the
100%.
information,
Yep. And that's where, or if they verify it, just like you
Yeah.
talked about, it's like, okay, I only heard it from this one source. Okay, but did you check it other places too? And was it still the same?
And is it a legitimate source?
Yeah. And that's
The
where-
balloon thing on TikTok.
You saw that on TikTok? Yeah.
I didn't like watch them do it, but I've watched them.
Yeah.
Sounded
Yeah.
cool.
Yeah.
What I dislike about TikTok is how incredibly exaggerated everything is.
Yeah.
So that's why I don't like that as a source. It's absolutely fascinating, and like I say, I enjoy learning from it.
So like for the cracking videos, like,
Oh, it's
does that
complete
make it
crap.
worse for
It's
you?
complete crap. Oh, no, I can't say that. So what they're doing, again, they're doing that for the views because it's incredibly auditorially satisfying, and that's why they'll get thousands of clicks and views, and that's how they're gonna make money off of that.
Chiropractors like.
Have you
actually do
seen
that
the
a
like
lot.
skeleton ones?
You make videos or?
No. No, but like the back crack, like, is that like something that's like a big thing that you do, or do you not do that very often?
Yeah.
You mean that it's not live?
No, just I mean, like,
Yeah.
they make it seem like that's the only thing chiropractors do.
No, I do a lot of things outside of that, correct, like I say, that's one thing, I guess, if it's saying, going back to the specialization, I do a lot of muscle work. Cause like I say, is it the chicken or is it the egg, is it the joint or is it the muscle, they feed into each other constantly. So you can get the joint moving, but if you don't address what's connected to that tissue, it's only gonna pull that joint right back out of place, or it's gonna lead
Muscle
back to those
memory.
habits, correct, those habits. So that's where I try to do a lot of those pieces together. But yes, people, when they're watching those videos, they're doing it more for the auditory sound, and that's where I say back to your safety part of things. People say they wanna come in, they wanna get, I want as loud, I want as much noise as possible. It's like, I'm sorry, that's not either possible for you because you've got so much degeneration or arthritis. Your body's not gonna move like that. Or, and this is the more probable reason, it's not safe to do that. But the people who are looking to make those videos are specifically looking for somebody who is as loud as possible, and they're taking advantage of that, which that's just their marketing thing that they like to do.
You got 2 more minutes?
Yeah.
Okay, 2 more minutes. Who's got burning questions now that we each got around the table?
What are some of the benefits and risks and different factors you need to consider if you're considering starting your own clinic or practice?
I don't have, that would never work for me, so I'm just gonna let you do that.
Are you looking more for medical doctor side of things, or you're looking more chiropractic side of things?
Either. Both sound good.
Say the whole thing, because there was a lot of questions in one.
Like what are some of the benefits and risks and different factors you need to consider if you want to start your own practice?
So the significant risks that you're looking at when you're starting a practice are you're gonna not have a job, you're not gonna have money, you're not gonna be able to take care of your family or do those things. Those are also your biggest motivators. The biggest benefits to that are the fact that I've got say and freedom to be able to do what I want. I also don't have the same freedom to do what I want because I'm in charge of all of it and I have to continue to take care of that. But the opportunities that it continues to provide me are endless. So I mean, like I get to spend, like I said, my family gets to come into me. You can't necessarily bring your kids into the hospital and say, I'm sorry, I don't have daycare today, or I don't have something else like that. I'm screwed. My kids can come into my office. They can't necessarily do that. Same thing with teachers, educators, professors. I mean, you can't do that. Your accountants, you can't necessarily do that. You can work from home maybe, but you can't do something else like that. That's an incredibly big blessing that I get to have. So that's where you look at then the risk, the reward part of things too. I mean, like me taking the massive risk of owning my own practice means I can't get fired. My wife would like to disagree with that. She wants to fire me sometimes. So that makes a big difference with it. But I also have the chance to completely lose everything that ties into it as well.
Part of the liability is the biggest thing too, you know, that just like you said. If you're gonna start a medical practice, you know, you gotta start somewhere and then you have to build going forward and.
And that's one thing why, so Health Source is the practice that I own. It's actually a franchise. So there's over 300 offices nationwide, and one in Canada. The reason I joined that form of practice is because then they can help me bounce ideas off of them. So again, like I don't have another chiropractor that's in my office right now. We're looking for people because it's a lot of fun. I love what I do. Not everybody wants to move back to Marshall. It's great, guys. I don't know why not. Okay. Please leave first. You have to understand how much more fun it is to come back. I have to put it that way because I had to go away first. It helps a lot when you can talk about business ideas or say, hey, I'm trying to invest in this now. I need to work on a website. I need to say, is this the right care for this kind of patient that's coming in? I need another read or another set of eyes on these x-rays that I have. That's where those camaraderies and those businesses make a big difference. You can work together.
Burning question.
Yeah, so having your own practice, are you like regulated by anybody or are you like under Health Source? Or like, how does that work, I guess?
Can you describe what you mean by regulated?
Like, does anybody oversee you and your business, I
Okay,
guess?
so government always does.
Yeah. Are you asking, can he practice the way he wants to?
Yeah.
Correct. So yes,
Yeah.
and that's like I say, part of the risk that I took, part of that is I looked at joining a number of different practices that were here in Marshall, before coming back here. And Hal said, yes, we'll take you on, we'll hire you. And I said, well, crap, if I've got that much interest in this, maybe I can try this on my own first. And if I fail, it's a lot easier to get hired by somebody else. There's people that have done that here in town. So no, I don't have anybody else regulating but myself. But like I say, I answer to my patients, number one, but then also to the government who is always watching over that kind of stuff.
But does Health Source have some guidelines?
No,
or
so,
parameters? That they say?
Recommendations, I guess, they say
Okay.
with that part of things. Yeah, so I
Because
can choose
obviously
whether I'm
their
gonna do that or not.
name is kind of tied. to
Correct.
How,
Yep.
if
yep,
he's a
how you're gonna
terrible
practice that way.
practitioner, Health
Yep.
Source isn't gonna want him, right?
Correct. Yep. So there, yes, there is some,
Guidelines.
essentially, yes, not necessarily guidelines saying, hey, are you willing to practice this way? If I am, okay, then you can join our family. But if not, then this isn't gonna be the right fit. Yeah.
Gotcha.
No, good question. I mean, it's the same thing when you're getting hired into any place. I mean, like, are you gonna fit in here or not?
Yeah.
That's kind of how it is.
Awesome.
And thankfully, they allow, the Health Source does a lot of the research, like I said, with a lot of these different tools or supplementations or medications, things like that. So I don't have to, I can do my hands-on stuff that I want to be doing.
So
And I would like to say just one thing. So all of you, no matter what path you go down, love what you're doing. Okay, I put in a lot of long hours, but I love what I'm doing. And I would do it again and again and again, over and over again. So yes, the paperwork sucks and the insurance, and to be quite frank, sometimes the patient is a pain in the butt, okay? But I love what I do, so that's why we do it. And if you head down a path and you're like, I don't know if this is it, if you don't love it, change your path. It's okay. It's okay to go way over here and then come back again. Because at the end of the day, you're gonna put in a lot of time and a lot of effort, and you wanna have kind of that, you know, that your heart is in it. You wanna be like, this is what I'm meant to do. Okay? And then you'll succeed too. I mean, if your heart's in it and you love it, you're gonna have success. That's my opinion.
That's awesome.
And that's what I tell my girls. You know, I got a daughter, I said I'm gonna be a grandma. So she has a big detour right now. But you know what? I know at the end of the day, she'll end up where she's supposed to be. And this detour is probably causing her to grow up and to mature and to look at her life and say, this is the route I want to go. And it'll be okay. So it's okay if it's not straight and you don't have a perfectly bump-free zone to get there. It's okay if there's bumps. Sometimes that's
There
even
will
better.
If you've got a bump-free zone, you're going the wrong way.
Exactly. So just follow your dream and just check everything out. And like he said, you gotta shadow, you gotta go check it out. If you hang out with one of us, you're, you know, let's say you go and you're like, I don't know if I like that. Okay, then you don't need to keep pursuing that, right? If you hang out with me and you're like, I don't think so, and you're done,
Bless you.
okay? Or you go, yeah, I'm intrigued, but maybe I want to see how a nurse practitioner approaches it, or I want to go be a CNA. Hey, I love the elderly. I'm going to be a nurse first, and then I'm going to come back this way. Same with like nurse anesthetist. A lot of people ask about that. Well, you have to be a nurse first, and then you have to work in the ICU for so many years before you can go to nurse anesthetist school. But I think by the time you get there, you know if you like it or not,
Yeah,
you know,
yeah.
so. Yeah, but medicine's awesome, and there's so many avenues, and they're all so rewarding. And at the end of the day, it's about the patient, and are you taking good care of them? So.
Let's give them another round of applause.
Okay, similarities and then just some general facts on PA.
Well, thank you. Thank you so much. All right. Thank you. A little token of appreciation. Thank you, thank you. All right. So we'll let these fine practitioners get off to where they need to go. So I'll hand these out. And then we'll talk about what you're gonna do as an assignment for what we just heard.
If anybody has extra questions or wants to chat or do anything else like that, she's got my contact information. When you talk to her, and I'm happy to do that. Or if you want to sit down and have lunch or have a further conversation, like I said, happy to do that kind of stuff.
I am too, but you have to go through Mary Fisher. Okay, so we don't get to determine.
Same with Chris, but it's a little bit bigger process that I can help you with.
Yeah, okay. And if you do shadow, usually we take you for a couple hours, about an hour until you're in PA school. Then you can do more, but a couple hours here and there sometimes
Give you a taste of what it's like.
Yeah. And unfortunately, some patients refuse to let you in the room. Other times they'll let you in. So it all kind of depends, but. All right.
Thank you so much.
Thank you.
Thank you.
You can leave it open. It's warm in here. Yeah. It's so warm in here. All right. How's that? Good. So good to hear from the people that, and I know you guys had a lot more questions. I know Chris is a friend of mine. I know she's gonna go home and work till 10 at least. So, all right. So what you guys are gonna do, so I'll have, these are the handouts that Chris brought. One is what is a PA and the other one is PAs and nurse practitioners. What is the same and what is different? So if you're interested in that, you can take that. I'll put that here. And if anybody, so Dr. Alley, unfortunately, like I said, she wasn't able to come because she was sick, but she does acupuncture and her specialty is, she likes to, treat women with infertility. So chiropractic can help with, fertility issues. So, I have her email as well. If that's something that you'd like to hear about. All right, so what you're gonna do, you're gonna do this guest speaker review form. And I already put their names in, just disregard Dr. Alley, like I said, because she wasn't here. So you can fill this out. Interesting things about the guest speakers, Chris and Dr. Rob, and then what did you learn? So you guys can go ahead and do that now. So you're done, put it in the assignment box, and then we're gonna be done. Maureen, you can do it, you get extra credit. Well, you're having intro to XI friends, they get it. So, go ahead and do that.
Thanks.
You did?
She got like, she had a slip disc in her back and then was like paralyzed in her back legs. But yeah.
Yeah.
I was like, he was like a holistic chiropractor vet doctor, and I was like, this is a bunch of quack stuff. But then he went and he did like acupuncture, like electro acupuncture, and like adjusted her and like did the laser, the heat laser. And that stuff was really cool. And it like actually worked. And then homeboy started